Hi, my name is Allie Stoddard. I own a CBD company, and I'm going to give you an outline of why CBD, this endocannabinoid system, is so beneficial for your patients and also for your work that you do with your patients. My background, medical devices. I owned a pain management distribution company with topical pain creams from the compounding pharmacy. I've worked in orthopedics, neurosurgery, general surgery, and a lot of wound healing, soft tissue, hard tissue, wound healing. And what I'd like to explain to you is that CBD or cannabidiol comes from the marijuana plant, or it can come from the hemp plant. By law, I work with only the hemp plant, and as it turns out, CBD or cannabidiol is the one nutrient that feeds this system in our body called the endocannabinoid system. There are a few other like omega-3s, DHA, and EPA. But for the most part, CBD is the agonist to the endocannabinoid system. If we can jumpstart your patient's endocannabinoid system, they can begin to balance the nervous system, endocrine, lymphatics. All the other systems in the body are intricately and intimately involved with the endocannabinoid system. The endocannabinoid system helps the immune system to modulate inflammation. So when we've got a toxin, it's the immune system that's quelling, containing, and killing that toxin, but it's the endocannabinoid system that's modulating it. So when your patient has arthritis and they're in this autoimmune type response, it's the immune system that's not kicking in, and we need the endocannabinoid system to kick in and modulate the cytokines to bring down the inflammatory cytokines, bring up the anti-inflammatory cytokines. It's a very complex system, the endocannabinoid system, but what feeds it is CBD and omega-3s, and that's where I come in. So if your client, your patient has peripheral neuropathy, anxiety, PTSD, any kind of chronic condition, autoimmune condition, I have worked with these patients to boost their endocannabinoid system. So what you're doing is more effective. So I'd like to ask you to refer your patients to me. I will be highly transparent, give you information back on what's working, what's not working. CBD, if grown organically, if manufactured without heavy solvents, without added chemicals, flavorings, synthetic chemicals that interrupt the endocannabinoid system. If we have clean products, then we can jumpstart this endocannabinoid system, and it can support the nervous system, the immune system, lymphatic system, and the respiratory system. With the coronavirus, with the Northern California fires, we have many people who have allergies, asthma, respiratory issues. Not only is that a function of the endocannabinoid system or of other things that I talk about, vitamin D, omega-3s, getting rid of the inflammation that's coming from the food that we're eating, which is mainly dairy, vegetable oil, sugar, and grains. Those are the 4 top inflammatory foods that we're eating today. So I can help your patients with all of these things so they can have a boost in their health. So greenalleycbd.com. My name is Allie Stoddard. I live in Lafayette, California, and I ship all of my hemp CBD products all over the world, all over the country. Hemp is now considered a dietary supplement. As of 2018, December, hemp was included in the Farm Bill. So CBD comes from the hemp plant. CBD also comes from the marijuana plant. that's where you go to the dispensary, because there is THC in that product. All of my products on greenalleycbd.com have no THC in them, or virtually no THC. There's 0.3% or less THC by law. Cannot get your patient high, cannot get them imbalanced in the middle of the night. I work with a lot of senior citizens, and when we ingest this CBD, a topical or a tincture, like I work with the third largest CBD company in the world called Elixinol. They have a very pharmaceutical grade product, testing on every single batch. And when we put the tincture under the tongue, gets into the bloodstream, we bypass liver production, and therefore the CBD gets into the bloodstream immediately. I see clients every day who use this for anxiety, and literally within 5 minutes, they feel grounded and they feel focused. With CBD from the hemp plant, you never feel high. You feel in your body. When you smoke pot, it's getting you out of your body. CBD is getting you in your body, grounded, focused. All that agita, all that noise that a lot of our clients who have a lot of anxiety, all of that noise gets filtered out, grounded, focused. It's a beautiful thing about CBD. It's an antioxidant, an anti-inflammatory. It's a neuroprotectant. Our football players who are getting chronic traumatic encephalopathy, there's a company called GW Pharmaceutical that is looking at CBD just for that issue. So I've worked with patients with brain injuries, concussion, anxiety, Tourette's, PTSD, pelvic pain, chronic pain, arthritis, all different kinds of neuropathies. You name it, I've seen it, and I can help your patients as well. I will always send your patient back to you. I will never advise that they get off of their pharmaceuticals. That is your job, and that is your realm and not mine. But my realm is CBD medicine, and this is a medicine. The safety profile is untouchable. There has never been a death or a serious adverse event due to healthy, clean CBD. Okay? The only death has been from a pharmaceutical product that was put on the black market. That was that company, the French pharmaceutical company that's developed a synthetic molecule to interrupt the endocannabinoid system. That's the only death that we have ever seen connected to CBD or cannabidiol, or for that matter, THC and marijuana. None of my products are THC and marijuana. For that, you send your patient to the dispensary. For CBD hemp that has 0.3% THC or less, you can travel with it. You won't fail a drug test. It is legal in all 50 states in the United States. Come to greenalleycbd.com. My phone number, 925-899-4539. askgreenalley@gmail.com. Send your patients to me. Call me up. I will teach you as much as I have learned in the last 10 years working with this plant, and I'd love to help you and your clients and your patients. Thank you so much.